Well, our big focus on the show today, there is a new variant of coronavirus in the United Kingdom, and it's causing major worries. Scientists have warned that the COVID variant, which has been spreading around the United Kingdom, has undergone further genetic changes. The latest tests have identified the mutation as E484K. This mutation has already been seen to spread rapidly among South Africa and Brazil variants. Well, for more on this, we're now joined by Dr. Julian W Tang, University of Hospitals of Leicester. Thank you so much, Dr. Tang, for joining us. Please first explain this latest variant to us and what are your concerns about it?
Okay, so the UK variant arose back in, say, September, October last year in the UK, and it spread through the UK, and we think it's more transmissible because more of the positive cases have this variant in them over time. And then just recently, last week, we saw that this UK variant, 501Y V1, has acquired a new mutation, the 484K mutation. Now, the UK variant already has a 501Y mutation, and it has a deletion, 6970 deletion, but not this 484K. But this 484K is in the Brazilian variant already, and in the South African variant already. And both the Brazilian and South African variants already have the 501 mutation. Okay, so the UK now has 2 out of the 3 mutations that are already present in the Brazilian variant and the South African variant. So it seems like the UK variant is gradually moving towards the Brazilian and the South African variant. And the reason for that may be what we call convergent evolution.
All right, now as a virologist, is there something different that you've seen about the way, this particular coronavirus is mutating? What are your concerns on that front? And this one has become more infectious.
No, so the viruses do mutate. Most of the mutations are fairly neutral, benign. Some of them will lead to dead ends. The virus will just die off. But the variants, the mutations that lead to ongoing transmission may well be because the virus is getting more used to the human population, so more transmissible, maybe not more lethal. We haven't seen really any differences in the symptoms the virus causes, but we know that the viral loads can be higher with the new variant. So if I take a swab from your mouth and then I test it and measure the viral load, that viral load might be 10 times higher in the new variant, for example, than the old variant. So if I'm coughing at you or breathing or talking to you without a mask on, or even with a mask on, you are more likely to get enough virus to cause infection if you're standing too close to me. So before, for example, where you could get away with standing within 1 meter, maybe you need to stand 2 meters away, and both of you wearing a mask. And maybe now you might need to wear a better mask. So instead of having just a surgical mask like this, you might need a better mask like this, okay, to protect you from this variant, because just because the viral load is higher, it's a higher viral load, and if it's a higher viral load, then you might be infected if you're closer to me.
All right, so it spreads a lot quicker as well. Now, what does this mean for the vaccine? Moderna has said that its vaccine works against the new variant. Does it work against the new variant?
The old UK variant, okay, the old UK variant with just the 501Y, the vaccines work fine against that. There's no problem with the vaccine against that, okay. It's the new UK variant, the new one, the 484K, is causing a problem. Okay, so we're getting variants confused here. The old UK variant, without the 484K mutation, the new mutation, was fine with the current vaccines, okay? But if this new UK variant with the 484K starts to spread, then the existing vaccines may not be so protective. And that's why both Oxford and I think Moderna have proposed to change their vaccines to incorporate that mutation so that when you get vaccinated, you produce an antibody to that mutated form of the virus. Okay, so that's the difference with the vaccines. Okay. Is that clear? So the two UK variants, the old UK variant did not affect the vaccine effectiveness.
And so how widespread, how extensively widespread is this new variant?
Okay, so so far we've only found a few of those. But of course, the COG UK team can only sequence about 5 to 10% of all positive samples. So we don't know whether they're missing some. And some people may be infected asymptomatically and not even been sampled yet. Okay, so it's almost certainly an underestimate of how many cases that we have here. And also, because this virus is transmitted very well pre-symptomatically, okay, so if Mr. Smith is diagnosed on Monday, Mr. Smith could be shedding the virus on Sunday, Saturday, Friday, Thursday, you know, for up to 5 days before he got diagnosed. And he may not know who those contacts are. So if he works in a supermarket, you know, stacking shelves or on the checkout, all these customers go past him and could be infected by him, but he doesn't know who they are. He doesn't ask their name. He can't remember who they are. So that track and trace doesn't work in that situation. So that you can, although you can diagnose him and isolate him, and the contacts he knows about, like his family and friends, he may miss all those contacts that he's had in the supermarket when he's working, for example. So the number of contacts they've had before they get diagnosed is important, and you know we can't remember those.
All right, now I want to talk about vaccines, and you know there's been great news on the Russian vaccine, the Sputnik V vaccine. India is expecting the Russia vaccine in a few months from now, and initially there were concerns, but now everybody's seen the results. It's over 90% efficacious. Your view on that? Yeah. So for that vaccine, it's good news because that vaccine is relatively cheap. It's a bit more expensive than Oxford AstraZeneca, but there's a reason for that, I think. And it's much cheaper than mRNA vaccines. And the efficacy level is just as high. So I looked at that paper and I looked at the first papers, and you know, you could say that the Russians were so confident about the vaccine, they were happy to roll it out in their population before even the phase 3 data came through. So they designed the vaccine, they were confident in the vaccine, and that's what they did. But the rest of the world didn't believe them. Okay, but now this paper's come out and shown that, you know, the efficacy and the adverse effects, the side effects are similar to the other vaccines, the AstraZeneca, to the Pfizer, Moderna, etc. And if you look at the numbers, the vaccinated arm, the non-vaccinated arm, the number of COVID cases in the vaccinated arm versus the number of COVID cases in the non-vaccinated arm, they're similar kind of numbers as the other vaccine trials. So you can't criticize them for that. And the efficacy is very good. You know, it's 90+%. Now, you know, I believe that. And it's better than the Oxford AstraZeneca, even if you look at just at face value. And one reason for that is because the Russian vaccine uses a so-called heterologous prime boost. It uses a adenovirus 26 in the first dose, and then it uses adenovirus 5 in the second dose. So that in between, the patient doesn't develop an immune response to neutralize the virus the vaccine second dose. Okay, because adenovirus is still a virus. If you inject somebody with adenovirus, they will create antibodies to it. And if that adenovirus contains the virus code, the code that codes for the S protein of the virus, when you inject a second vaccine, a second dose, with the same vector, you may actually then neutralize that vaccine. So the Oxford AstraZeneca vaccine, it has chimpanzee adenovirus for the first dose, and it'll use chimpanzee adenovirus for the second dose. But for the Russian vaccine, it uses adenovirus 26 for the first dose, but then adenovirus 5 for the second dose. So the body will not create an antibody response to neutralize the second dose. All right, Dr. Julian Tang, thank you so much for speaking to us here at NDTV. Well, it's time now to take a look at the numbers. India recorded 12,408 cases of coronavirus in the last 24 hours, slightly lower than the previous day. 120 deaths in the last 24 hours, which is, however, higher than Thursday's 107. The number of people who have recuperated from the disease has surged. The national COVID recovery rate is now 97.16%, while a COVID case fatality rate now stands at 1.43%. And if we take a look at the vaccinations, now India is still a little short of reaching the 5 million mark, but the Health Ministry has issued a global graph on how India is the fastest nation to reach the 5 million mark. So you can see those numbers there. India reached the 5 million mark in 21 days, while the USA took 24 days, UK 43, and Israel took 45 days. Well, let's now focus on Kerala. Now, Kerala has overtaken Karnataka in total COVID cases to emerge as the second worst affected state in India after Maharashtra in terms of the virus caseload. It overtook it yesterday. It also has the highest number of active cases in the country. However, the state has performed relatively better in controlling the number of deaths. It has the lowest fatality rate among the top 15 worst hit states in the country. And there you can see the daily case count over the last week and how it's been the highest in the country. Well, to talk more about Kerala and what's happened really in its fight against COVID, we are joined by Dr. Sulfi Nuhu, a Central Working Committee member. Thank you so much of the IMA in Kerala. Thank you so much for joining us. And so what is the reason that we're seeing the cases being so high in Kerala, which was initially touted as a success story?
Yeah, you cannot say a single reason why there are more number of cases in Kerala. We can point out so many reasons. I think the most important reason is probably the population density in Kerala. We have a lot of people, traveling across the border to other countries and as well as to other states. It's there, and the reopening of schools, offices, and all those things, all those crowds has created increase in number of cases. The cinema theaters has opened, the schools, office, everything has, it started working. Even at the time in which the disease was not under total control, and also the election, local self-government election has happened here, and it is just over now. And now there was a lot of overcrowding in that election process. So all these reasons are there. But I think, we were just discussing about a lot of variants happening in South Africa, UK, Brazil, and in some parts of US. And there are many medical professionals believe that there may be some kind of mutation in Kerala. It's an RNA, the adenovirus, and it's definitely we can have a lot of mutation happening, and it's not proved. It's just a postulate that there may be some kind of mutation in Kerala. It's also a possibility, but we have to prove that. But at the moment, we have a low mortality rate, but the cases are still more, and the test positivity rate is also more. Now the government has decided to increase the number of testing. Yesterday they have tested around 89,000, almost 90,000 for the first time. So the government is taking all measures to contain the disease, but the fight is still not over, and I think we have to wait much more than expected at the moment.
Right, Dr. Nuhu, you spoke about possible mutation, and this is something that we're seeing, of course, abroad in the UK, in Brazil, and South Africa. Is some study being done to check whether there's some mutated virus that is spreading faster in Kerala?
Yeah, see, what has happened is, if you look the world scenario, even in very, very well-developed countries like UK, US, and many other countries, we do not have facilities to test the mutations. To study the 40,000 nucleotides in this thing. So we have limited facility to test that. I think the government is doing their best to test whether there is a variant or not. We are still waiting for a final opinion from the experts regarding the mutation. So it's just a possibility. We are just thinking about such a possibility. We have to, in India, what is happening is we do not have much facilities. Not only in Kerala, in many parts of India, we do not have facilities to test the genomic mutation. But so probably we will come out with an answer in another week or so, whether there is a mutation or not. It is the effort is on to identify that whether there is a mutation. So we are expecting a positive results. Maybe we can find out the exact cause why Kerala is having a high rate even at this moment.
All right, Dr. Nuhu, thank you so much for speaking to us here at NDTV. And yes, it is a big worry as to why Kerala is seeing such high number of cases even now, given that such steps were taken initially to counter the spread of the virus. Thanks so much for joining us on the show today. Well, with that, time for us to slip into a short break. On the other side, we'll focus on Germany, and the Chancellor has said that the COVID, the second spike, is now behind them. Welcome back. Now on the show, we're going to focus on Germany, and Chancellor Angela Merkel has said that Germany is over the peak of its latest surge in coronavirus cases, but that she wants to wait for data on the spread of new variants before deciding on any lifting of the restrictions there. For more on Germany's situation, we're joined by DW's Anja Koch from Berlin. Thanks so much for joining us. Now in Germany, the number of infections is going down, while Portugal, on the other hand, is facing an increase. Can you give us some details?
Yeah, the infection rate in Portugal indeed started to soar in the beginning of January. Since then, the number of active cases has gone up by more than 240%. There are basically two main reasons to that. The first is that there was a relaxation of social distancing rules during Christmas. People traveled, people visited their families. And the second reason basically is the Portuguese authorities said that the new strains of the virus, the more infectious strains, are already widespread in Portugal. Now, the situation there looks like this. The hospitals are overflowing. The health ministry said that over the past weekend, there were only 7 free ICU beds left for the whole country, and the government has now asked for help. Germany, for example, has offered that kind of help. Germany said they would send ventilators, among other things. Now, here in Germany, the numbers of new infections are actually going down. Active cases have dropped by around 40% since December. But having said that, there's also growing concern in Germany about the new strains of the virus. The German government just recently installed a travel ban for people coming from those countries where the new strains are already widespread.
And Germany started vaccinating people roughly a month ago, but the vaccination campaign is being met with increasing criticism. Why is that, and what is the government doing?
Well, especially elder people are complaining that the process to actually get an appointment is much too complicated. But also young Germans feel that the vaccination campaign is going too slow, and indeed manufacturers have fallen behind on deliveries. When we compare the numbers, when you see Germany has so far managed to vaccinate around 2.4% of its population. When you compare that to other countries, to the UK, for example, they have already managed to vaccinate around almost 14% of the population. So this week, the German government apparently felt the need to reassure Germans that they have understood the criticism. So the government organized at the beginning of the week a so-called vaccination summit, a meeting between Chancellor Merkel, regional leaders and representatives of the pharmaceutical companies.
Right, and what was the outcome of that meeting?
Well, I think the most important outcome, at least for Germans here, was that Angela Merkel repeated her promise that everyone would be offered a vaccination by the end of the summer. That would mean by September 21st. That date is becoming more and more important for Germans. And she also said that she expected more deliveries by BioNTech. BioNTech is expected to deliver 75 million additional doses to the EU in the second quarter. But Merkel also stressed that in that first quarter of the year until March, there will be a shortage of vaccine that makes a quick end of Germany's lockdown very unlikely.
Anja Koch, thanks so much for speaking to us here at NDTV. And finally, American pharma giant Pfizer, whose COVID vaccine has 95% efficacy and had applied for emergency use authorization in India, has told NDTV that it has now withdrawn its application. In India, Pfizer was the first company to apply for emergency use authorization of its vaccine. A Pfizer spokesperson told NDTV that the company had a meeting with the subject expert committee of India's drug regulator, and the decision to withdraw the application was made after that. The spokesperson said, based on the deliberations at the meeting and our understanding of additional information that the regulator may need, the company has decided to withdraw its application. Pfizer will continue to engage with the authority and resubmit its approval request with additional information as it becomes available. And that's all the time we have on the show today. Thanks so much for watching. Goodbye.